Hi, this is Dr. David Tenner. We're here at the Goldberg Tenner Clinic, where we specialize in the reversal of chronic disease. And today I'm delighted to be joined by Miss Megan Nicholas. And Megan came to see us just a few months ago, and she had some pretty significant health issues that she was concerned about. And she's here now doing much, much better. And she's going to share her experience and her story. So Megan, I'm going to turn it over to you. Just briefly tell us the concerns that you had when you came in, and then I'm going to kind of get back to the beginning when all this started. You can certainly tell us your story and how things led up to where you were at when you came in.
Sounds great. So I had been on a little bit of a roller coaster ride, mostly around my thyroid, and when I came in, I had gained 30 pounds. I had in the past had a goiter in my thyroid. I was losing my hair, brain fog significantly, not great energy, just overall feeling really, really terribly. And so came in looking for some answers on that, and had searched high and low on the internet, a little bit of a rabbit hole, and found the Goldberg Tenner Clinic, and am happy to report feeling really good.
Mm-hmm. This all started with you back in 2018. I've got Megan's history here. It's a long one. She wrote it out for us. But she was rushed to the emergency room, right, with a gallbladder attack. And what happened at that point?
Yeah, so woke up in the middle of the night, terrible pain, rushed to the emergency room, and they determined that I had gallstones, and that spent the night in the ER. They took me to the local hospital the next day, and they determined that my gallbladder needed to come out and that one of the gallstones had escaped. And so they went in and did two procedures. They did one to grab the gallstone, and the second to remove my gallbladder. And it was a lot of pain, so a lot of quick decisions were made. And it should have been a 1 to 2 day night in the hotel. It ended up being almost 11 days because I then became septic. And so there were a lot of complications. And after that, went back for my post-surgery checkup and was really interested. You know, I was young, I didn't have a lot of health issues in the past, was really interested in why I needed my gallbladder removed and what caused the gallstones. And in the post-op or the post-surgery appointment, they were not interested whatsoever in finding out why. And that was a red flag for me, and I figured, okay, I need to get some things sorted out, and I need to figure out what's going on with my body and why I needed that emergency surgery at such a young age.
And that event is what really led to the downward kind of cascade with your health at the time, and the 2-year battle that kind of ensued after that up until the time that you came here. But she said an important thing, because you had this gallbladder attack and you became septic, which is probably a really stressful experience for you, resulted in the loss of your gallbladder. And the pertinent question that you asked was, there's some set of factors that cause this. What are they? Because you can ultimately remove diseased tissue, but you can't cut out what caused it.
Mm-hmm.
So ultimately what ends up happening in most cases is that you just start developing health issues elsewhere in the body, and that's what happened with you. So in your search for answers, you found yourself seeing some alternative practitioners here in Atlanta in the realm of alternative medicine. What center had you gone to?
I had gone to Progressive Medical, and I thought I was doing the right thing. I was like, okay, I know there's something wrong. I know I need to get to the bottom of it. I'll go down clearly my conventional doctor was not interested in helping me out, so I'll look towards this alternative medicine and try to find some answers. And so I did that, and that's really, I'll say the roller coaster really started there as well.
And so when you went, you had some testing done, mm-hmm. and ultimately what you were diagnosed with?
I was diagnosed with hypothyroid at the time, okay. And we did probably 15 different tests, and we realized that there were some digestive issues, but mostly that I had some thyroid issues that were probably causing a lot of the symptoms that I was having.
And what were the recommendations that you were given? How were these things going to be addressed in that health center?
Yeah, so there were a lot of recommendations given, but I would say the biggest one that was given was supplements, lots and lots of supplements. And I was probably going in every 30 days, and I would leave with a piece of paper with 30 plus supplements on it every single time that I was there. And I was spending insane amounts of money on supplements. And at first I was like, this is really easy. I'm just going to take these pills and I'm going to get better. And that is not what happened. I ended up getting worse and worse and worse.
Okay, yeah. The mistake a lot of people make, and this isn't your fault per se, because most people are not aware of these things when they go down that path. But the realm of conventional medicine and alternative medicine are really not any different. People often think they're getting something different, but they're really just getting a different form of medicine. They're trading one set of pills for another set of pills, and it's just such a common scenario, and it misses the boat entirely because it still doesn't address the cause of the problem.
Right.
The fact that your thyroid was low, that you had digestive issues, and some of the other things they diagnosed you with, like leaky gut, which is a very common diagnosis, are still were not caused by a deficiency of 30 supplements.
Right.
Right, any more than they're caused by a deficiency of other treatments and drugs. So you're just trading one form of treatment for another, and then people end up in this never-ending cycle of therapies, treatments, supplements, drugs, and it becomes an ongoing nightmare. And we see this story time and time and time again. So as I understand, after all those supplements and the care that you're receiving, your weight was continuing to go up, you were losing your hair, you were having a lot of brain fog, and then ultimately you went to see an endocrinologist after that, and then what happened there?
Yeah, so the alternative medicine, my antibodies ended up going up. They put me on to a NP thyroid, a medicine.
That's when you were diagnosed with Hashimoto.
That's when I was diagnosed with Hashimoto's, yeah. And so they put me on that, and all of a sudden it got even worse. I had a goiter, and so I was like, I need to go, and maybe alternative medicine's not the answer. I need to go back and see a conventional doctor. So I went to see an endocrinologist, and they were like, all right, stop everything that you're on, which I did, and we did that for about 3 months. And things started to get a little bit better, but then all of a sudden it started to ramp back up, and I was gaining even more weight. The hair loss was getting way worse, and so they put me on even more medicine. So now I'm kind of I'm seesawing back and forth between these two methods, and both of them seem to make the problem worse.
Right, so you were going from one extreme to the
Yes.
other. Hypothyroid, then you became hyper. You had a goiter.
Yep.
Your physiology and your biochemistry was really getting thrown in all kinds of different directions.
Yeah.
You were getting way out of balance, and your health continued to decline.
Yeah.
And so that's when Megan ended up here.
Yes. And I was. I would say I had searched the internet high and low, had been looking for what was the right way to do this, and we were looking, and my husband found this online and said, hey, it says they don't treat with supplements and they're not going to treat with pharmaceuticals, like let's give this a try and see if we can, treat the body and really figure out how we can get you better. And it's been a fantastic experience. I went from seesawing all over the place to really stabilizing in a fairly short amount of time.
Mm-hmm. And so one of the real hallmarks or kind of cornerstones of our practice is that we don't treat disease. Mm-hmm. People come in with every kind of thing you can think of, from cancer to heart disease to autoimmune disease to diabetes, rheumatoid arthritis, and everything in between, but we don't treat anything. So then what is it that we do? Well, we work with people to really investigate the specific reasons that led to the development of their problems. Mm-hmm. Getting back to the original question that you asked is, what caused your problems?
Yeah.
What factors led to this? And in doing some investigations with Megan, we started to sort out the reasons why this happened. And with your thyroid gland in particular, a lot of this likely started with some original digestive issues. The stress of all of the surgery, the hospitalization really took a toll on you. And anytime the body takes some hits and things have taken a toll, the glands are going to get weak. Yeah. But the answer is not to throw thyroid hormone at you, but to start to rebuild you and recreate you, to tear down some old tissues and really rebuild the body from the ground up, get everything in balance so things start working right again. Not by forcing the issue with drugs and piles of supplements, but by getting you to do the right things to recreate your health and recreate your body. When they start putting you on thyroid hormone, which happens to so many women and men now too, what most people are unaware of is that is a form of thyroid. It is a form of hormone replacement. Your own gland will get weaker and weaker the longer you take it, to the point where you'll be you're only about 29 years old. Mm-hmm. If you stay on that long term, chances are you need to remain on it for life as your gland starts to atrophy out. Yeah. Are you on thyroid medication now?
Nope.
No. All right, so she, I think, was on it for about 6 months or so total. Yeah. She's been off it now for, I think, 3 to 4 months or so. Has your weight started to normalize?
Yes.
How much weight have you lost?
I'm down 20 pounds.
Down 20 pounds, looking good, down 20 pounds. How about your energy level?
Much better. It's stabilized, it's normal, it's been really nice.
And the hair loss?
Has gotten so much better. As we went through this process, of course, there's some initial detoxing, but it is really stabilized and is feeling much better.
Mm-hmm. So all the symptoms of the so-called hypothyroid and Hashimoto's have really resolved. And this is off the medication now.
Yep.
Off the medication. So we're going to be getting some an update soon on your thyroid panel. I expect to see it as likely as normalized, and we'll share that result when it comes in. But with the improvements in your weight, your hormones, your brain fog, the hair loss, and all the classical symptoms of hypothyroid having improved so much, I expect to see that result to look good.
Yeah.
All right, so you have really come a very long way, and certainly there's some important lessons to be learned in Megan's case from the overuse of supplements, for the difference between treating the body and recreating the body, getting down to causal factors as opposed to treating disease. These are some really fundamental and important concepts for people to understand, why I'm so delighted for Megan to be sharing her story today, because I think the lessons that can be learned from her experiences will really hopefully help others to take a different approach, one that is involved with addressing causes and recreating the body as opposed to treating symptoms. So Megan's been a wonderful patient. Part of the reason she's done so well is because she's followed through and worked hard. The things we have people do not involve just, hey, go home and take 30 pills, which is really, that's a passive form of care. How hard is it to go home and pop pills? It's not very hard.
No.
Megan had to follow through with some of the recommendations that we made, which involved changes to her habits. She had to be disciplined, she had to follow through, and you didn't feel well right away, did you?
No, it took about 4 weeks to get through that initial phase, but after that really started to see an uptick and starting to feel much better, and now we're
about 3 to 4 months out. Yeah,
feeling great.
Mm-hmm. And most people are going to go through some rebalancing initially, where they can feel worse before they feel better as we start to undo all the things